Thank you, Prerna. Thanks for reminding me. Otherwise, I would have gone on and on. Anyways, I'm not going to repeat what I said, but I guess we all know. So any questions that you have from the last weekend and from this weekend? So we have completed 4 hours. And today we are going to, I don't think we are going to complete all the 2 hours, but yeah. So if you have any questions, please do ask me. If everything is clear, then we can just go ahead, jump in right into video presentation. And just give me a moment while I pull that up. Let me know if my screen is visible to you all. Okay, thumbs up. I've seen the thumbs up. And when I play, if you're not able to hear, please, raise your hands and then we'll work out. Okay.
Well, Dr. Amen, it's a pleasure to meet you. Thank you for making your way on a very rainy day here in Los Angeles to spend time with me. I'm looking forward to discussing all things brain health, optimizing brain health, focus, memory, cognition, preventing things like cognitive decline, dementia, Alzheimer's. I'm interested in the mutability of the brain and brain health. And we're going to talk about your new book also, of course, Raising Mentally Strong Kids. I'm a parent of 4 kids. This is very interesting to me. But I think the 2 primary motivating things that made me most excited about sitting down with you today is first, a little over a year ago, I was diagnosed with ADHD, which came as quite a surprise. Many questions for you about this. It was not something that I thought would be something I would be associated with. The second is that my mother is currently in the throes of dementia, obviously a quite devastating situation, as you know all too well. And so I want to learn as much as I can about how to help her, how to help my dad, as you also might imagine, is in a very challenging situation. And of course, to do everything I can to avoid a similar peril for myself. And as much as that might sound like I'm trying to make this about me, I'm actually not. Maybe a little bit with the ADHD part, but when you consider the statistics on dementia and Alzheimer's, it really is about all of us, isn't it? I kind of looked up some statistics about an hour ago, and it's quite devastating the extent to which these diseases of dementia are kind of taking over and growing at alarming rates. In 2023, 6.7 million Americans over 65 have Alzheimer's, which is like 1 in 9, 55 million around the globe. 2/3 of these people are women, which is fascinating. And it's very much on the rise. I saw some statistics like by 2060, the CDC predicts a 7-fold increase, and globally from 55 million to 139 million by 2050. So this is a problem that is going to leave very few people untouched.
No question. I mean, if you're blessed to live to 85, you have a 1 in 2 chance of being diagnosed with dementia.
1 in 2.
1 in 2, which means it's either you or your partner, and that's horrifying. But what most people don't know is you can have an impact on that. And since 2005, I wrote a book with my friend Rod Schenkel called Preventing Alzheimer's. And I updated it in 2017 with Memory Rescue. And the big idea is if you want to keep your brain healthy or rescue it, you have to prevent or treat the 11 major risk factors that steal your mind. And you talked about your mom having it. The mnemonic that we'll talk about is called Bright Minds. And the G in Bright Minds is genetics, but we don't think about it properly. Oh, well, I'm overweight because my family's overweight, or I have hypertension because it runs in my family, or I have diabetes because it runs in my family, or I have Alzheimer's disease, or I'm vulnerable to it and there's nothing I can do about it. And that's a lie. Genes increase your vulnerability and they teach you what you should be doing. So, for example, I have 6 children. 3 of them are adopted. 2 of my nieces we adopted because their parents couldn't stop with drugs and alcohol, and it was a disaster for these kids. And I tell my nieces, if you never drink or do drugs, you're never going to have a problem. But if you do, it could be serious. You need to be on an alcohol drug prevention program every day of your life. I have obesity and heart disease in my family. I'm going to be 70 this year. I'm not overweight and I don't have heart disease because I'm on an obesity heart disease prevention program every day of my life. So if you have it in your family, as soon as you know, you should be serious about preventing these 11 major risk factors.
I want to get into all those strategies, but let's talk a little bit about what's driving this. What is causing this? I mean, I would imagine a portion of the spike that we're seeing, this increase in incidence, is related to the fact that people are living long and baby boomers are aging up. But also, I suspect that lifestyle habits are contributing to this as well, with the increase in type 2 diabetes, obesity, hypertension, and the like. So what's causing cognitive decline?
Our seriously unhealthy lifestyle and undisciplined minds. Did you know depression doubles the risk of Alzheimer's in women and quadruples it in men?
What is the relationship between depression and dementia?
So many people think if you're an older person and you get depressed, it's actually a precursor to dementia. They're both brain diseases or brain problems, if you will. And it's critical in the M in Bright Minds mental health stuff. So I get so excited about this because what I came to realize, I started looking at the brain in 1991, and we've looked at over 250,000 scans. But early on, I came to realize you're not stuck with the brain you have. You can make it better, and I can prove it. And so if I look at your brain and then you have a car accident, your brain's going to be worse. If I look at your brain and then you go on a drug bender, your brain is going to be worse. If I look at your brain and then all of a sudden you stop sleeping or you go through a divorce, odds are your brain's going to change in a negative way. But I also did the big NFL study. When the NFL was sort of lying they had a problem with traumatic brain injury in football, 80% of my players got better. I could see the damage, but when they go on a brain healthy program, 80%, their brains looked better anywhere from 2 to 6 months later. That's exciting. I was a consultant on the movie Concussion, and I was sort of bummed because the movie's sort of a downer. It was
Is
about
that the Will Smith one?
the Will Smith one.
I remember that.
And it's like, where's the hope? And the message on football dementia, or CTE, chronic traumatic encephalopathy, the message in our society is wrong. It's like, oh, you have this. It's chronic, progressive, untreatable. And so players don't come and get help because they feel hopeless. It's like, no, get help early, probably while you're still playing, so that you can begin to reverse the damage. It's the big, exciting lesson over the last 30 years in neuroscience, neuroplasticity. You're not stuck with the brain you have. You can make it better. There's an area of the brain called the hippocampus. Why I collect seahorses. It's Greek for seahorse. It's shaped like a seahorse. Every day, you are making 700 new stem cells in the hippocampus, or I think of them as baby seahorses. Your behavior is going to grow them, or it's going to shrink them. And so if you're vulnerable to dementia, that's the area that gets hit early in dementia. And you want to love those seahorses, nourish them, feed them, teach them, rather than get them drunk or stoned or shrivel them.
Your main protocol in evaluating people's brains is this imaging technology called SPECT, right? So can you describe what that is?
So can I tell the pre-story
Yeah.
just to put it in context? So when I was 18, Vietnam was still going on, and the government had a draft, and I became an infantry medic where my love of medicine was born. But about a year into it, I didn't like being shot at. It just not for me. It's for some people, it's not for me. So I got retrained as an X-ray technician and developed a passion for medical imaging. As our professors used to say, how do you know unless you look? And then 1979, I'm a second year medical student. I just get married. And 2 months later, my wife tried to kill herself, horrified. And I take her to see a wonderful psychiatrist. And I come to realize if he helps her, it won't just help her. It'll help me. It'll help our children, our grandchildren, as they would be shaped by someone who's happier and more stable. So 45 years ago, I fell in love with psychiatry, and I've loved it every day since. But I fell in love with the only medical specialty that never looks at the organ it treats. And I knew it was wrong, and I knew it would change. I just had no idea it'd be part of it. 1991, I'm now a psychiatrist for about a decade. And I went to a lecture at my local hospital on brain SPECT imaging, single photon emission computed tomography. It's a nuclear medicine study that looks at blood flow and activity. It looks at how your brain works. And it basically shows us three things: healthy activity, too little activity, or too much.
How is it doing that? What is the process by which that's revealing itself?
So again, it's a nuclear medicine study. So what we do is we take a radiopharmaceutical. So you take a radioisotope. We take one we use is called technetium. And technetium has self-esteem problems. It doesn't like being who it is. And it changes shape. And when it changes shape, it produces a photon, or a little packet of light, that we can measure. So we combine technetium with HMPAO, a medicine that's easily taken up by cells in the brain, combine them, inject them into your arm, and it's called a first pass extraction. So 70% of it is taken up in your brain in that first pass, or within about 2 minutes. And then, so it's the hardest part of the procedure: a little tiny needle into a vein in your arm, inject the medicine, it lights up your brain, and then we can measure it, have you lay on a camera table. It's not claustrophobic. It's not like an MRI. People lay on the camera heads come around your head in about 15 minutes, and we get about 10 million counts, or 10 million times that little piece of light hits the crystals in the camera. And then we reconstruct it, and it looks like a brain, and we then can see in your brain which areas are most active, which areas are healthy, which areas are sleepy, compare it to our massive database. And my 8-year-old grandson can look at a scan and go healthy or not. And it's so helpful to look. And off camera, we talked about controversy. So I start looking at the brain. I'm like a little kid, so excited. And we never make a diagnosis from a scan. So that's really important. We make a diagnosis, like all doctors, with all of the information. Take detailed histories. If you came to see us, you'd fill out about an hour's worth of paperwork, talk to our historian for a couple of hours. I mean, we really get to know you. And then we would test your brain. We do a computerized neuropsych assessment, and we would scan your brain. And when you put that puzzle together, it's so powerful. The first patient I ever scanned. So I went from the lecture on brain SPECT imaging given by the head of the hospital where I worked into Sandy's room. And I hadn't met her. I just met her. She tried to kill herself the night before. And as I was talking to her, I'm thinking, she has adult ADD. Impulsive suicide attempt after a fight with her husband that she caused. IQ of 144, but never finished college. When I go, tell me how you studied. She said, well, I really never did unless it was the night before the test. I put on a pot of coffee, stay up all night, do the test. She had an 8-year-old son that had ADD. So in my mind, I'm feeling pretty confident about this. But when I broached the subject with her, she's like, oh, adults can't have ADD. And I'm thinking I'm the doctor. She was resistant. I said, well, why don't we look at your brain? And I had been doing a study called quantitative EEG up to that point. So I knew I needed to do it twice, once at rest, once while she did a concentration task. And then after I got the results a couple of days later, I'm in her hospital room. She has a table. I put the scans on the table. She had a healthy brain at rest. And when she tried to concentrate, her frontal lobes and her cerebellum, which we'll talk about, dropped. It was so clear.
What does that tell you?
The harder she tries, the worse it gets. It's a classic, is what I was predicting I would see, because that's what I saw in quantitative EEG. And when I showed her the scans and explained them to her, she starts to cry. And she said, you mean this is not my fault? And I'm like, people who have ADD, it's sort of like people who need glasses. They're not dumb, crazy, or stupid. People wear glasses. I wear glasses to drive. We're not dumb, crazy, or stupid. Our eyeballs are shaped funny. And we wear glasses so we can focus. People have ADD aren't dumb, crazy, or stupid. Their frontal lobes and cerebellum often turn off when they should turn on. So medicine or supplements or other strategies we'll talk about so you can focus. I could see with the image that her shame melted away and her compliance went up. And she took the medicine. Her relationships were better. She was underemployed, as many ADD people are, finished college, got a better job, and was in touch with her for about 10 years.
So this was sort of an inciting incident that allowed you to see the benefits of using this as a diagnostic tool, this imaging technology.
Yes.
Yeah.
I like it when my patients get better. So I went into psychiatry and it was totally personal for me. And I loved it. But I was already getting criticism from it. It's like, oh, we don't do this. It's not standard. It's not what we do. But 1992, all-day seminar at the American Psychiatric Association, brain SPECT imaging and child psychiatry, because I'm also a child psychiatrist. And I'm so excited because I'm meeting colleagues who do it. And in 1993, I teach with that group. So I'm like all in on the technology. But it was 1993, lots of pushback from the American Psychiatric Association because it doesn't fit the current diagnostic paradigm.
Mm-hmm.
It's like, stop giving people the diagnosis of depression. Depression's a symptom cluster. It shouldn't be a diagnosis. It's sort of like chest pain is a symptom. It's not a diagnosis, right? If you have chest pain, it doesn't tell you what's causing it, and it doesn't tell you what to do for it, right?
Right. It's just indicia to look deeper and use other diagnostic tools to confirm what's happening. But that was 20 years ago. Is there a sense that the medical establishment has changed its tune? Because if you look at your Wikipedia page, it's like a diatribe on, the lack of scientific efficacy with respect to this imaging technology.
Yeah, I don't know what to do about Wikipedia. 2016, January, I published 80 studies. People go, oh, he's never published his work. It's like, dude, do you read? Discover Magazine listed our research as one of the top 100 stories in science for 2015. I was pretty excited about that. 2021, the Canadian Association of Nuclear Medicine wrote procedure guidelines on SPECT, basically as if I wrote them. And 5 of the 10 authors had been my students at some point. I've had 10,000 medical and mental health professionals referred to our 11 clinics.
And 250,000 scans that you reviewed. So that's
people from 155
It's a massive
countries.
data set. What are some of the general trends that you see? Like, what can you extract from that giant data set that speaks to brain health, the mutability of brain health, and the types of conditions that you see most consistently in the patients that end up in your clinics.
Well, can I stay with the controversy just a little bit longer? Because it really irritates me. The people who criticize me say, oh, he's only doing it for money. Oh, you can't see these things in the scans, even though they're not experts. But what's the alternative? I mean, I had said it earlier, psychiatrists are the only medical doctors who virtually never look at the organ they treat. Think about that.
And obviously, if you have a brain dysfunction, that's going to dictate a, mental health outcome.
Well, if we agree that your brain controls everything you do, right? How you think, how you feel, how you act, how you get along with other people. And when it works right, you tend to work right. And when it's troubled, you're more likely to have trouble in your life. If your brain, the moment by moment function of your brain creates your mind, then why wouldn't you assess the organ that you're working on? And so just a little more history. In 1993, I start to get anxious because I have two big flaws. Now, I've worked on them a lot, but I like people to like me. And you can't change a medical specialty if you're anxious about what people think of you. And I hate conflict. I'm a middle child.
You and I both.
I hate conflict, and I like people to like me. And all that changed in 1995. So I spent from 1993 to 1995 just anxious because I knew I had to do this, right? There's not a choice. Once you look, you can't unlook. And 1995, I get a call late one night from my sister-in-law, Sherry, who told me my 9-year-old nephew, Andrew, had attacked a little girl on the baseball field for no particular reason. And I'm like, what? And she said, Danny, he's different. He's mean. He doesn't smile anymore. I went into his room today and found 2 pictures he had drawn. One of them, he was hanging from a tree. The other picture, he was shooting other children. So if you think about it, he's Columbine or Sandy Hook or Parkland, Florida, waiting to happen. And I'm like, I want to see him tomorrow. And they lived 8 hours from me. So they brought him to me. I'm like, buddy, what's going on? And he's like, Uncle Danny, I'm just mad all the time. I'm like, is anybody hurting you? No. Is anybody teasing you? No. Is anybody touching you in places that shouldn't be touching you? No. And 999 child psychiatrists out of 1,000 would put him on medicine and therapy. And because of my experience, I already scanned 1,000 people at that point. I'm like, he's got a left temporal lobe problem. And so I'm like, I held his hand while he held his teddy bear and got scanned. And he was missing the function of his left temporal lobe. I'd never seen it. I've seen it 100 times since then. It turned out he had a cyst the size of a golf ball occupying the space of his left temporal lobe. And I told his pediatrician, I said, you find somebody to take it out because he wasn't in my neighborhood. And he talked to 3 neurologists. All of them said they wouldn't touch the cyst until he had real symptoms. At which point I lost my mind and I start screaming at the pediatrician. I have a homicidal, suicidal child who attacks people for no reason. What do you mean real symptoms? And he got anxious and he said, I think they mean like seizures or he loses consciousness. I'm like, serious? And in my head, I'm like, neurologists, neurosurgeons. Neurosurgeons will do stuff. So I called UCLA, talked to the head of the pediatric neurosurgery department, Jorge Lazarev, and he said, Dr. Amen, when these cysts are symptomatic, we drain them. He's obviously symptomatic. And after the surgery, I got 2 calls. One from my sister-in-law who said the surgery went really well, and when Andrew woke up, he smiled at her. She said, Danny, he's not smiled for a year. And then I got a call from Dr. Lazarev who said, oh my God, Dr. Amen, that cyst was so aggressive that put so much pressure on Andrew's brain that thinned the bone over his left temporal lobe. So his skull had been thinned. He said if he would have been hit in the head with the basketball, it would have killed him instantly. Either way, he would have been dead in 6 months.
That's an amazing story. What's so interesting is the idea that our personalities are not static, that something amiss with the brain could completely change a person's outlook on life, how they show up in the world, the thoughts that they're entertaining. And in the case of that example, like a simple procedure, not a simple procedure, but a procedure could completely change that.
Good or bad, right?
Yeah.
It can go
Could go the
either
other way.
But after Andrew, and it's now 30 years later, 29 years later, Andrew's married, has 2 children, has his own business. I mean, he's normal. And it was that moment I lost my anxiety and my need for you to like me. That's when the war began to try to change psychiatry to become, it's like, come on, we need to get into the 21st century. And 1979, when I told my dad I wanted to be a psychiatrist, he asked me why I didn't want to be a real doctor.
Yeah, he wasn't happy about it.
Why I wanted to be a nut doctor and hang out with nuts all day long. But that he was just reflecting what society believes, that you're weak if you have a mental health problems, you're bad if you have a behavioral problem. And the images clearly taught me free will is not 0 or 100. That free will is gray. And I ended up testifying in some death penalty cases. And so if I'm right, and I am, that means 40,000 psychiatrists and hundreds of thousands family practice doctors, OBGYN, internists, that they're practicing witchcraft by making diagnoses based on symptom clusters with no biological data. Last year, 337 million prescriptions for antidepressants. That's insane. What's happening in our society is just tragic, and we need a different way. And the mission I have in my life is crazy, but the mission is to end mental illness by creating a revolution in brain health, which is why I'm so excited about brain health.
It's a bold statement. It's a great mission. I love it. I think ancillary to what you just shared is there's a lot of misnomers when it comes to mental health, like language is important and the words that we associate with some of the things that people experience are perhaps not in the best interest of healing and welfare. Can you talk a little bit about that? Like the idea of just talking about disease in general with respect to mental health?
So of the 337 million prescriptions written for antidepressants, virtually no one was talked to about their diet, about their sleep habits, about if they turn on the news first thing in the morning. I love the idea of getting my patients excited about making their brains better, rather than you have borderline personality disorder and you're probably not going to get better, but here are the things to do. Or you're bipolar, you're going to need to take this medication for the rest of your life. I'm in Justin Bieber's docuseries Seasons, and he came to me diagnosed with bipolar disorder on lithium. I scanned him. That's not what he had. But can you imagine being 23 and people saying you have a mental illness, you're always going to have this mental illness, you need to be on this medicine for the rest of your life? That's insane, with no biological data. Or one of my favorite stories is Adriana, who I just dearly love, normal 16-year-old, beautiful, goes to Yosemite. They think it's a magic moment when they're surrounded by 6 deer. 10 days later, she becomes aggressive. She starts to hallucinate. She's paranoid. She's hospitalized, given a diagnosis of schizophrenia. And after 3 hospitalizations, multiple medications, the family spent $100,000. Adriana's a shell. She comes to our clinic, sees one of our doctors. Her brain's on fire. Why is her brain on fire? We see inflammation. Turned out she had Lyme disease. On an antibiotic, within a year, she's normal. She graduated from Pepperdine. She's got a master's degree from the University of London. She's normal. I think infectious disease, and we'll talk about COVID because it's part of it, is a major cause of psychiatric problems. And nobody knows about it because people aren't looking at the brain. And so you asked me, what are sort of the big lessons I've learned? Mild traumatic brain injury is a major cause of psychiatric illness. And nobody knows it because they don't look. One of my friends was mountain biking and had an accident. He fell, broke his helmet, didn't lose consciousness, never had an anxiety disorder, panic attack, depression, never in his whole life. He's in his 50s. All of a sudden, he's having panic attacks. Doctor put him on Prozac and Xanax, very common combination. And for the wrong brain, it's big trouble. He became suicidal. He saw me on TV and I came to see him. He had a dent in the left front side of his brain, his left frontal lobe, his left temporal lobe. I'm like, do you have a brain injury? No. Are you sure? What I found is you got to ask people multiple times. Do you ever have a brain injury? When I see it on the scan, I'll generally find it. Did you ever fall out of a tree, off a fence, dive into a shallow pool, car accident, concussion, plane sports? He's like, oh my God, 2 weeks before I had my first panic attack, I had a mountain biking accident. And I broke the helmet. I didn't think anything of it because I didn't lose consciousness. Consciousness is a brain stem phenomenon. So you can really do damage to your brain and not lose consciousness because you don't damage your brain stem.
Yeah.
Yeah, Phineas Gage, the famous case in neurosurgical history, was a railroad construction worker in 1848, and his job was in explosions. He'd explode out the rock so they could lay the railroad tracks. And one day there was an accident that happened. His 3-foot tamping iron, he was tamping down the fuse and sand and gunpowder, and he dropped the rod, caused a spark, then an explosion, and it went through a missile underneath his left cheekbone, took out the left front side of his brain, landed 30 yards away. And he looked to his friend and said, did you see that? And then he looked to another friend. He said, did you see that? He didn't lose consciousness, but obviously it damaged his brain, changed his personality. He was conscientious and a man of good character before that. And then he got fired because he couldn't stop swearing and he didn't show up and he had these crazy ideas and then was a stagecoach driver and then moved to where all these people move, which is California.
Every athlete I know is going to tell you that having the right gear is key to performance. If what you're wearing is poorly crafted, it's just going to put distance between you and those goals you've set. You owe it to yourself to invest in the best, and the best is On. I'm obsessed with the Cloud Ultra, great on the trails, and I just got the new next-gen Cloud Stratus 3 for the road. I'm loving those. But On also has this incredible...
And then you think early fame, which is one of the worst things for brain because you wear out your pleasure centers in the brain. All of that excitement and then unlimited money with very poor supervision in a brain that doesn't finish developing until 25. I mean, just see sort of...
Yeah, it's a recipe for
disaster.
Some kind of dysfunction.
And, one of my other sort of patients I dearly love, Miley Cyrus, got the Grammy this year for Song of the Year. Makes me emotional because the song's really about love and loving yourself. But it was a shit show for a long time.
She's been on a journey, hasn't she?
She's been on a journey. I'm just so proud of her because she's in charge of her life rather than fame's in charge or drugs are in charge or other people are in charge. I mean, I work really hard with my patients for them to become good CEOs of their life, but you have to take care of the executive center in your life, which is your prefrontal cortex, largest in humans and any other animal by far. If you damage it with head trauma, drugs, alcohol, bad food, not sleeping, social media, it's not a good prescription.
What are some of the top line, most important lifestyle protocols or interventions that you recommend when your patients come through and you see something lighting up or not lighting up in these scans, and realize that there's work that can be done to course correct.
So it depends on your brain. I mean, there are things everybody should do, like love your brain. And I horrified myself, I don't know, I guess about 10 years ago when I went, brain health is 3 things. Brain envy, got to care about it. Nobody cares about their brain. Why? Because you can't see
We don't
it.
see it.
You can see the wrinkles in your skin or the fat around your belly, and you can do something when you're unhappy with it.
I also think we're just not taught to care for it. It's
We're
not,
not.
something that we think about. We know we should eat better and all the like, and we know we can learn things with our brain, but there isn't a broad sense that we can improve our brain health through certain lifestyle choices that we're making.
Immediately your brain's worse if you're drinking alcohol or if you're smoking pot. Immediately your brain's worse if you don't prioritize sleep, if you eat crappy food, going back to these 11 major risk factors. But it's 3 things: brain envy. So when I started 1991, I scanned everybody I knew. I'm like so excited. And I scanned my mom. She was 60. She had a beautiful brain, which really reflected her life. She has 7 children, 54 grandchildren, great-grandchildren. Wow. She knows everybody, still 92. She knows everybody's name. She knows what's going on in their lives. And she's just someone that she brings people to her. I scanned myself a week later, and it wasn't nearly as good as my 60-year-old mother, and that just irritated me. But I played football in high school. I had meningitis twice as a young soldier, bad for the brain. And I had bad habits. I never drank, I never smoked, but I wasn't sleeping. I thought I was special, like I could get by on 4 hours of sleep. And I'm not special, I'm stupid, because sleep is critical. I was overweight, I didn't care. I'm a double board certified psychiatrist, top neuroscience student in medical school, and I don't care about my own brain. I saw it and I cared. I have envy. I want my mom's brain. And so I always say Freud was wrong. Penis envy is not the cause of anybody's problem. You need brain envy. You need to love your brain. And that's where brain health starts. It's like, oh, I have this organ that creates me. Let me love it. And then avoid things that hurt it, just got to know the list, and do things that help it. And again, you just have to know the list. And if we do the Bright Minds, it says what to avoid and what to do.
Mm-hmm. Yeah, those 11 sort of principles, right, that are built into that acronym.
Yeah, they're everywhere in my head. Like B, for example, is for blood flow. Mm-hmm. Low blood flow is the #1 brain imaging predictor of Alzheimer's disease. So if you have it in your family and I scan you, we're going to look. I mean, SPACT is a study that looks at blood flow and mitochondrial activity. 49% of the tracer is taken up in the mitochondria. So we're going to look at blood flow and energy. And if it's low, we're going to go, why? Head trauma, is it drugs, alcohol, caffeine, nicotine, not sleeping, having high blood pressure, being overweight. And we're going to target the reasons why it's low. And then we're going to do exercise, increases blood flow. I love exercise. Ginkgo is one of my favorite supplements because the best brains I ever see have taken ginkgo. Oregano, cayenne pepper, beets increase blood flow. So know your risk factor and then know what to do. And the trick with exercise is coordination exercises. People who play racket sports live longer than everybody else. This is a replicated study on like 90,000 people, because what coordination does is it activates your cerebellum, little brain, 10% of the brain's volume in the back has half the brain's neurons. And if you activate that, it turns on the rest of your brain. So I'm a huge fan of table tennis and pickleball and tennis.
It's bad news for me. I'm very athletic, but when it comes to anything involving eye-hand coordination, I'm terrible at it, and so I've avoided it my whole life.
But that's good news for you if you can get over yourself.
Because there's more to be gained, right?
Yeah, get a really good ping pong coach. And don't judge yourself. Just go and learn to be good. And don't have to beat people. If you spent a half an hour twice a week, it'll have a major impact on your ability to think. Because you got to get your eyes, hands, and feet all working together while you think about the spin on the ball. I think of it as aerobic chess.
I have this thing, which I think might be fairly common, which is this idea that perhaps I'm past the point of no return. So let me explain. I was a competitive swimmer growing up. So between the ages of like 14 and 21, I was training, 4 to 5 hours a day, waking up at 4:30 in the morning and walking around overtrained like a zombie. So I wasn't getting good sleep. I never felt rested. I always felt fatigued during that period of time. Alcohol became quite the thing around age 18. And from 18 to 31, a progression into alcoholism. And during that period of time, maybe getting one good night of sleep while the rest of the nights were blackouts or recovering from blackouts. I get sober at 31, but from 31 to 40, I transfer a lot of that addictive energy into my lifestyle choices. So I was basically sedentary and subsisting on hot dogs, French fries, pizza, McDonald's, Jack in the Box, while not exercising. At around 40, I have a come to Jesus moment. I changed my lifestyle habits and many things about my life, and I'm a much healthier person now. I eat a plant-based diet. I'm very fit and active. I'm engaged mentally through the process of doing this podcast and other things that I do. And my life is good, but I can't shake this sense that I have done so much damage over the course of my lifetime that no matter how many good things I do now, that at some point I'm not going to be able to overcome that damage. It's going to catch up to me. And so what's the point in doubling down and really investing in all of the things that you're saying? And I think on some level that might be common. People are thinking, well, I've treated myself terribly.
Oh, I think
that song has been
common.
Sung. So,
but it's a lie.
Mutability is your whole thing. Like we can't, but is there a period at which, I would suspect it's more difficult than it is for others, but what would you tell someone like myself or someone who's of a similar mindset or a similar type past history?
Well, one, we should look, right? How do you know unless you look? And so many people go, oh no, I don't want to know.
Yeah, I'm scared. I'm a little scared.
If you knew a train was going to hit you, wouldn't you at least try to get out of the way?
As long as there was a possibility to get out of the way.
Of course.
If I couldn't get out of the way, just let it hit me and I'm none the wiser.
So I do a show. Actually, I want you to be on it. Scan My Brain on YouTube and Instagram. And one of my favorite guys, Troy Glaus, 2002 World Series MVP, played third base for the Angels. Love him dearly. Drinking way too much. 4 concussions, depressed, suicidal. He was in a dark place, didn't think there was any hope. And I got him to do my show. I don't know how that happened. His brain was awful, like awful. But he did what I asked him to do. And his wife, Anne, who I dearly love, she was a good partner. He stopped drinking. He ate better. Exercised, took the supplements, lost 15 pounds in 2 months. And I'm like, let's look again. Because I could just tell he was better. His brain's significantly better.
In a 2-month period.
2 months. And then I scanned him 16 months later.
How old is he?
47 now. And, there were ups and downs, right? When you're an alcoholic, you just don't stop. Some people do. But, there was some bumps for us. But, we're in the fight together. And 16 months later, his brain is so good. And I know 5 years from now, if he continues on and he has brain envy, his brain's going to be freaking normal. You have a choice. But if you don't know, if you don't look, you don't know. And why would you ever be in that position? I want to know, which is why, every couple of years I'll get a whole body scan, because if trouble's coming, I want to get it early. I don't want to wait until late.
So many of the lifestyle illnesses that we're seeing now are tracked to chronic inflammation. So what are some of the things that we can do to ameliorate that have implications in terms of brain health?
So in Bright Minds, the first I is inflammation. And some surprising things is like 98% of us have low levels of omega-3 fatty acids. If you're not taking an omega-3 supplement or focused on eating low mercury, high omega-3 fish, that's a problem, because low omega-3 increases inflammation. If you're not a bit obsessed with your gums and your teeth, if you have gum disease, you're more likely to have brain disease and heart disease. And I didn't
Just
really...
to drill down on that a little bit, it's always amazing to me that doesn't get enough bandwidth in terms of our overall health, because I know I've had periodontal disease and gum problems my whole life, and I was educated early about the implications of not treating that well, because that tends to lead to atherosclerotic issues. And brain health, obviously, it's a circulatory situation. It has to have implications in terms of brain health.
Absolutely, because your brain is 2% of your body's weight, but uses 20% of the blood flow in your body. 20% of the oxygen in your body goes to your brain.
And if you have gum disease, infections in your gums, periodontal issues, abscesses, and the like, how does that translate into circulatory issues? Like, what is happening?
You have a higher risk of Alzheimer's disease. So it increases inflammation, which, many people think is the mother of all illness. I don't know about that, but I don't want to have inflammation. And for a long time, I didn't really care about my own gums until study after study. Gum disease, heart disease, gum disease, brain disease. I'm like, no, got to take care of them. So become a flossing fool.
In terms of blood work, what should people be paying attention to? I mean, you mentioned omega-3s, but if someone's doing a blood panel and they get the results, what are some things that would jump out to you?
So if we look at some of the important numbers for Bright Minds, like blood pressure would be for blood flow, retirement and aging, you don't want high iron levels. Iron accelerates aging. You don't want low iron, because that'll make you not sleep and be anxious. And I tend to accumulate iron, so I go donate blood twice a year, and that seems to help. Good for other people, good for me. For inflammation, you want to know your C-reactive protein. For genetics, you probably should know your ApoE4 gene type. I'm a 2-3.
Is that the gene that's connected to
that increases
dementia, the
the
Chris
risk.
Hemsworth situation?
Yes,
where
he's
he
a
had
double
allele or whatever? Yeah.
Yeah, he's a E44, which means he has a tenfold risk. But a tenfold risk means about 25%. And so it just means be serious and exercise. The kind of exercise you're doing decreases the risk if you have one or two E4 genes. For head trauma, it's just the number of head traumas you have. Toxins, how's your liver function? So liver function tests, mental health, it's your ACE score, adverse childhood experiences, 0 to 10. How many do you have? My wife wrote a book called The Relentless Courage of a Scared Child. She's an 8 out of 10. My nieces, who I adopted, are both 9s. I mean, if you have 4 or more, it increases your risk of 7 of the top 10 leading causes of death. If you have 6 or more, you died 20 years early. Now, my nieces and my wife aren't dying 20 years early because there are things you can do to extract the past trauma, which is super important. The second I is immunity and infection. So know your vitamin D level and get it above 40. People who are above 40 have half the risk of cancer of those who are under 20. And when I first tested mine, when I sort of figured this out 20 years ago, I was 17. I'm like, how am I 17? Because I exercise, but I exercise at night because I'm working during the day. And I realized I need more sun and I need to supplement to have a healthy level, not too much, but a healthy level. And then N is neurohormones, get them tested every year. We're living in a society where low testosterone levels are rampant in young males. And I've just never seen anything quite like it.
What is contributing to that?
Head trauma and toxins.
Are more young males having head trauma than they used to be?
Well, with football and soccer and skateboarding.
I'm going to just stop it over here. We have completed. Sorry, I had to stop it because of the time, and I wanted to engage in a discussion. I don't know what you all received from this video presentation, but this video presentation is absolutely important. We're already looking at the foundational principles, right? And Dr. Amen focuses a lot on brain, stresses a lot on brain health. And I would just like to, I have made several notes over here, but I would like to understand how you have received the information from this video presentation, because that is very important, how you perceive it as a person. So I am an individual of my own and I've perceived it in a certain way, right? And sometimes we only receive information that we want to hear, and the rest of the information is, it escapes. So I will just open the forum, and anyone who wants to volunteer and start. I know Padmanika cannot, and I know Olga came in a little later, but Prerna, Anna, what are the insights that you have received from the video presentation? If not all, just in a gist of what exactly you extracted from this video presentation.
Oh my God. If there were more doctors or healthcare workers like him, we would live in a very different world. Because like he said, there's different reasons for brain not functioning properly, and sometimes it's even an infection, and I have personal experience how I have life-threatening symptoms, and documents of that, and the doctors were like, oh, you're just depressed, because they had no interest to look at the thing and actually make any effort. So it's so easy for them to go, oh, it's in her head, because it's something that nobody can really look at.
Yes.
Except he's looking at it and finding real answers, and he clearly had so much compassion for his patients and people that he was working with. And I've never heard that you can actually use that kind of imaging and see the different parts of the brain and how they're working and all that. So it's brilliant that something like that actually exists. But I don't know if many other doctors or psychologists are using it in any way, because
yeah, and that's why I want. That's why I wanted to introduce this, because Neuro-CBT is all about understanding every system of your body. It's all biological. Whatever we have studied so far, the bookish knowledge does not teach us about our organs, how they play a role into triggering mental disorders. One of the interesting things that he said is depression. He called it as a symptom cluster rather than diagnosis. Isn't that amazing? And all throughout, even my life, we are taught how to make an assessment and diagnose someone with different kinds of mental disorders. Just like I even mentioned it yesterday, DSM-5, now I think DSM-6 is out. The US's Statistical Manual of Mental Disorders. It shows you how to assess. But he has a very different view on how he looks at the brain. This is not taught, but this is very important, especially when we are getting into the field of helping people who go through various kinds of problems. That's why I said, in neuro-CBT, you're not only going to learn about healing, at that mental level, at that emotional level, but it is also your physical health. So bottom line, the holistic health. I really love when he said that it is a symptom cluster. And I have been hearing this for the past 2 years. And I've been thinking, that's why I said I had to relearn. I had to unlearn whatever I learned, and then I had to relearn something that is very practical, that I connect with even as an individual, even when I look at my life. So this is amazing. Thank you, Anna, for your insight. And Prerna, please, I'll move on to you for your insight.
Yeah,
Oh, yeah.
Dr. Stuti, just
Yes,
wanted to
sorry,
add
Dr.
one.
Yes, please
Yeah.
go ahead.
Anna, yesterday when we were talking about the brain thing, you remember we have learned that the imaging that he uses is SPECT, that is single photon emission computed tomography. So
Yeah. I mean, I
yes,
heard it yesterday, but I
yes,
mean,
yes.
like before this course, I've never heard of
Yes.
it before.
So that's the scan he's talking about, that he got also for his mother at the age of 60, and her brain at the age of 90 also was better than his brain.
Yeah.
I mean, obviously he looked at the scan, and then he analyzed it. So his clinic and his practice, they are diagnosing the things with the scan. This is something like he mentioned specifically about Justin Bieber. His scans were normal. He didn't have this bipolar disorder. So this is a very good news, right? You understand someone and you diagnose and you make the diagnosis and you find out like, okay, this is not the thing. And also with one of the girl who has the Lyme disease. Right.
Yeah.
She
In Europe,
she was she was getting treated for all the dysfunctional disorders of brain, but she
Yeah.
has this parasite, tick.
Yeah, but in Europe and North America also, they for some reason the doctors do not treat it. So whoever has it gets another diagnose, and then they have to take something that doesn't help them at all.
Yes.
So,
I also met someone from Bulgaria, and
yeah.
she has had a Lyme's disease, and she was being treated for multiple sclerosis for so long. And then she came to India, and she got the diagnosis, and then simple the antibiotics and all. So yes, definitely. Yeah. Okay. Over to you, Prerna. You wanted to, this is your turn to tell something about this. Yeah.
Yeah, so I was actually, it was a burst of information that came over, and I'm so glad that, I saw this video because it opens up your mind so much that, how brain is linked to small things that we do in our daily lives. Uh, in the lifestyle the choices that we make in the lifestyle impact our brain health so much. And we take our brain for granted because we never think of it actually, because it is not there. We are very concerned about our liver, our kidneys, our skin, everything, but no one thinks about brain. And in fact, this is the most important part that we should be focusing on. And Dr. Amen, he's so passionate about it, and it is also, it is very I found it really, I got really anxious to know that how the health of your teeth can also impact your brain and your heart health, and how important it is to have, oral hygiene, and also, what you eat, and also if you have any problem in brain, the symptoms might not be physical. They can be behavioral also. Like he quoted an example of his, the little boy that he talked about in the video, and how he had a cyst, but there were no physical symptoms, but there were behavioral issues. And had he gone to a maybe a psychotherapist or a psychiatrist, perhaps they would have never known, and they would have put him on medication. And thanks to him, that this got in notice. And yes, so other than that, what I picked from this is that you need to eat healthy. You need to motivate people to develop brain envy in them, so that they are able to take care of their brain. And if they find someone who's happy, healthy in their life, there's a reason for it. And the reason is that the brain is healthy. And the brain is healthy because they're making healthy choices consciously. Like the mother of the doctor, she is not doing anything special. She's just living her life the way it should be. Like, she's very simple in her choices that she's making. She's not maybe perhaps not complicated. She's totally devoted to what is supposed to be done from her, and she's not over ambitious. So all these things are helping her to have a healthy brain. So don't take pressure. Don't watch murder mysteries, perhaps. Don't think of who raped whom and who killed whom. Just be positive, think good thoughts, eat good food, and life is great.
Thank you, Prerna. And Olga, do you have some insight, like from whenever you joined to watch this presentation, anything that you would like to say, if you are there, and if you're not asleep? Olga, probably, I don't know if Olga, Olga, are you there? She's on mute. Okay. So, Padmanika was just saying, I wanted to read it out. She said, I always wondered, how can we fix mental illnesses? Because in our books, we can only assess and diagnose and know the symptoms. It was very enlightening to know that looking at brain scans really help in this regard. And rightfully, because Padmanika is just entering into the field of psychology, and this is going to be a very different dimension for her. In fact, before she started the course, I told her mother, I said that for Padmanika, she is going to gain that knowledge. She can probably teach her teachers, probably help them to kind of rethink on whatever they are teaching. So absolutely, there are certain I made certain notes, and of course we can't go through all of it. You see how time runs so fast, and I don't know about you all, but I enjoy every bit of it because I am passionate about this. Even like Dr. Emmons' vision is related to brain revolution. That's what he said, right? He wants to bring revolution. And so he is introducing this different stuff. And sometimes people, there could be people or doctors, medical professionals who are doubting whatever he is doing. In fact, people have said, but Dr. Emin is quite clear about his vision. And, my vision has been to create or, what do you call it? I don't know if create is the word, maybe someone can help me, is to build a network of professionals, practitioners who are able to help people holistically, who are able to actually, when we do therapy, we are called therapists, right? We are called practitioners, or we are called coach. But I say we are the facilitators. We facilitate. We help individuals channelize, whatever they are going through. And with brain health, this was significantly important. And we are going to go into the heart, other organs as well, because you see somewhere in line, he also mentioned about the oxygen, about the blood flow, then the heart and the lungs and the digestive system as well. And of course, your liver and kidney also play a very huge role. But then, what we get to learn and understand is all our system is interconnected, isn't it? It is interconnected. And many at times the behavioral problems that we see in people, when people come to us, we only think of the other dimension of what we may have, of what may have happened, in the childhood or all that stuff. But we we bypass the fact that something is going on with their physiology. Something is happening, or the blood flow is not happening right, or maybe they are not eating right, or maybe we never think about asking them. Now I started asking, are you sleeping well? The main important thing, are you sleeping well? Are you hydrated? Are you drinking enough water? You know, the kind of exercise, again, the pointer that he made about even the exercise, the particular kind of exercise he gave it a name as coordinating exercise, where all your system is coordinated. So that type of exercise, and he gave an example of table tennis, if I'm not wrong.
Yeah,
You
ping
know,
pong.
yeah, ping pong. Yeah, the ping pong. Exactly. And I love ping pong actually. But beautiful. In fact, when we play sports, the sports activity, you would know that the amount of energy and the positive energy that is released in the process. So any kind of sports I used to play when I was, staying out of India. I was so involved in sports. So I would play ping pong, I would play table tennis, badminton. I would love sports. But the coordinated exercise, that is what the focus is, the coordinated exercise. Every exercise that we do, it needs to be coordinated. That your every organ is coordinated, and that's when the endorphins are released in the brain, right? That is a brain chemical that is released, and that is also cause of happiness. The other thing that picked up on is decision. The decision that we make. We have free will. So the decision of loving our brain, the decision of how we have perceived this video presentation, of how we are going to apply it, of what we have, whatever we have extracted, perhaps we won't be able to do all that stuff, but the little information that is important, the decisions that we take, because it is all based on that. You've all made a decision to do this course. It is a decision, right? Healthy decisions build healthy life, doesn't it? So, when this is all part of where we are going into therapy, what kind of therapy, of how you're going to facilitate any kind of session, when you go out there in the world, and after you have learned all this, how you're going to facilitate, how you're going to coach someone, change and transform their life. Because precisely Dr. Emin is helping us transform our brain. He is encouraging us to love your brain. Envy is like loving your brain, and no one thinks about loving their brain, because it's such a yeah.
Loving your brain is a joke. Otherwise, love, because it's always about heart.
Yes,
It comes from the
lot
heart.
of focus on heart, which is also important. But then I love his
Absolutely.
point. I love his point. That's why, learning from different neuropsychiatrists and what they bring in, the wealth of knowledge that they bring in for us. It is, merging all of that information together and creating. Mind to me now is creation. Mind to me is creation. We create everything that we extract from, like, whatever we see here, and so we are extracting and we are building on it. We are taking decision to build on it, so amazing, and thank you for the insight, Anna, Prerna, and Olga. It's okay, I do understand Padmanika is not able to talk. Padmanika also said happy to know that we are part of this amazing vision and will create the ripple effect in the world. I am very sure, because as I said, this is a trailer. This is a trailer. This is just an introduction. And as you go along, you're going to get an opportunity to join the dots. Because as I said, this Neuro-CBT practitioner course is not only about getting a certificate, getting a diploma, accredited one, but it's all about transformation. One other thing that I could hear from Dr. Emin. He himself went through the experiences in life, right? He himself went through the experiences of life. He himself went through the transformation. And now he is passing that torch of light to others by imparting that knowledge. And I think any coach, any practitioner they need to have that kind of vision. They need to have that kind of vision. It's not about how many sessions are. It's not about that. It's about how we are going to journey with someone who is facing difficulty in their life, how we can journey with them, and how we can bring them from this end, from A, and take them to B point. Right? It's all about that. So I hope that this video presentation enlightened you, and I'm sorry to start it late, so this would happen. That's why I want to go with the flow. So it may go over, even if it goes a little over 6 months, it's okay, because that this is also going to be part of research project. So after 2 months, we are also going to engage into a topic, and we are going to develop research on it, because as I said, as a group, we will develop something to give it out to the world, right? And it will be published in a well-known publication. And I did mention that my husband is a research scholar, so he is going to help us do that at the end of it. But the whole point of doing it is that we all engage into this with a passion, with a vision, to change how people have perceived mental illness, mental disorders. Just now we learned something very new, that depression is what? It's a symptom cluster. It can't be diagnosis, but it's a symptom cluster, and I do believe that. I stopped diagnosing people actually. I stopped assessing people and giving them the diagnosis, you are da da da. I stopped doing that. The amount of fear we create in people, they come to us with a hope to change the situation, whatever they might be. Someone wants peace, someone wants to get what do you call it, get their problem solved. They have some questions in their mind, and so people come to us with very different needs. They may have different needs, but what should be our focus in that? So I stopped telling people that, oh, let me first see, now let me do your assessment. And I used to do that initially. But after a period of time, something within me awakened me to learn something very different than what traditional therapists or practitioners were doing. I wanted to change a person's life. I did not want to commercialize, because I am also I am what I am because I have a vision, because I have a clear vision, and that's why I do what I do. And so I changed my approach in even in clinical settings. So when people come to me now, I make it more like education. I make it more like, let me awaken them to what they don't know, to what they are not aware of. So maybe awakening them to their own body system and connecting them to their own body system, rather than telling them about their diagnosis and then talking to them endlessly about their issues, right? So yeah, a lot of things that I wanted to share, but I have some pointers here, so I will put it in the notes, and again I will share it in the group. And for, I think yesterday I gave you an assignment, 1 or 2 page. Again, today's 1 or 2 page, a little bit on, your insight in detail. What is it, summarizing your interpretation basically on this video presentation. I would also encourage you all, if you can keep a separate book, a notebook for this class, because every week we are going to learn something new, and I want to join the dots as we go along. So last week, when we talk about the cells, how they absorb, and when we talk about brain, it is connected to it, and we need to know how it is connected to it. So that is our job, that how is it connected. Whatever we are learning, we have to connect the dots. So maybe taking notes, not maybe, actually taking notes is going to help you. It is going to build a structure for you, because then you won't get lost about what you're learning. You will help your brain to channelize, okay, this is this and this is how it is connected. So whatever even we are discussing, whether Anna is discussing something, giving her insight, or whoever, because we all are here with a purpose. So I'm sure this purpose, as I said, it goes beyond learning. It goes beyond learning. So yeah, I will encourage you all to keep notes. And I think this is it for today, unless and until you have something before we conclude today's session. It is 1.5 hours that we did. We started at 5:30. 3, maybe just after a little, 5:30. We are ending it at around 7. But I would like to ask you if you have anything, any questions, anything that even Dr. Aarti may say something, may summarize. Dr. Aarti, if you have something to say, you can please go ahead and say it.
No, I don't have anything specific. You already spoke about it. And also, Prerna also mentioned that oral disease and Alzheimer link. And I recently actually reviewed this one of the paper, and it is very fascinating that how oral disease, especially periodontitis, is linked with the dementia, Alzheimer. It's hurtful to know that inflammation in such a part where we really don't put a lot of interest in can cause mental health deterioration, as well as the thing like dementia and Alzheimer's. Oh God. So very interesting talk from Dr. Amen. Thank you, Dr. Stuti, for sharing that one with all of us.
Most welcome.
Beautiful.
Most
Yeah, it's
welcome.
beautiful.
Thank you. Thank you so much. So thank you once again, and we look forward to, like as even Prerna said, let's be serious, because as we go along, every session counts. We are investing our time, and I think we should take this very seriously. So I'll put a note, a kind note to everyone, for everyone. Please do make sure that during weekends, unless and until there is emergency, because as I said, see, I'm not the only one. I'm not going to say, oh yeah, you have your diploma certificate. No, we have to be accountable. If we are not disciplined, then there is no point. We would never learn in life, right? And I had to do the same thing with me. I hated getting up in the morning at 4:45, but I have made it discipline since past 2 years. I'm waking up like at 4:45, or at 5, but now I'm getting up at 4:45. Recent changes I made into my lifestyle is I would get up and then do my all my work and then have shower, because all my work is online, right? So I would be very lazy having, but then I decided I need to make a decision. I need to be clean. So now I get up at 4:45, I start having shower, cold shower, that is. It's very important as we are doing this. We need to be disciplined, and because this will help you to be the best. It will make you to be the best version. So I really request, this is my kind request to everyone. Sometimes we also take things for granted. I have done that all my life. It's like, we take it as a pinch of salt, but this is like, internationally accredited. It holds a lot of value. I'm sure you guys have done your research on the accredited organizations who have accredited us. So it is beyond this diploma. It is, there is a rule that 80% of attendance, but also online, like you have to just appear, like you can't just say, oh okay, I have this. Sometimes in emergency, yes, but that there is time. If for some reason you're not able to make it for the weekend, let's mutually talk in a group, because we are a family now, right? So let's mutually talk in the group and say, oh, I won't be available for the weekend. See, I myself make sure I keep my family aside during this session, because this means a lot to me. I am accountable. I take the responsibility. So I make sure I keep all my work aside to just be here. Okay, so that is Saturday, Sunday set for me. Sometimes our brain says that we are tired, we can't, but I am like, no, there is a responsibility, there is an accountability. Let's be that. Okay, so as I said, if there is any time weekend, if it's hard for you to come for the weekend, if there is a function or something usually happens on the weekend, it's all right. We will discuss in the group. I'm sure everyone is very you cooperate. So then we can discuss on a mutual time that I want everyone to be part of it. Otherwise, it's kind of like, this is also good, but I want everyone who is enrolled to be part of it. So thank you so much for hearing me out. Thank you so much for your patience. You all are so beautiful. And I'm so glad and grateful for each one of you for your insights and everything that you bring to the table when we have these sessions. Have a lovely day, and I will put the notes again, not today, tomorrow I will. tomorrow I will. Whatever I promise, I do it. So I won't be able to do it today, but I'm definitely tomorrow. I'll put out some notes. And any questions that anyone may have, you please reach out to me. If you have any questions regarding anything, please do reach out to me. I would be happy to help you guys. Okay, even Dr. Aarti, she is an expert in this field, like she's a medical professional. So she brings a lot of insight as well. So anyways, thank you so very much. Have a lovely, 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 lovely day ahead, weekend. And God bless you all. Bye-bye.
You too.
Thank you, Dr. Stuti. Thank you, everyone. Bye-bye.
Bye-bye.
Thank you,
Bye-bye.
everyone.
Bye.